Prostate cancer is one of the most widespread health threats men face, yet it often goes unnoticed until it reaches an advanced stage. Many men miss the early warning signs, dismissing subtle changes as part of the aging process. However, catching this disease in its initial phases can make all the difference, increasing the chances of successful treatment and a full recovery. In this video, we will break down the key symptoms that could indicate prostate cancer, highlight the risk factors that every man should be aware of, and explore the preventive steps that could help lower the chances of developing this condition. Stick around until the end, because recognizing the warning signs early could save a life, maybe even your own. Understanding the prostate, a small gland with a big impact. When people think about vital organs, the heart, brain, and lungs usually come to mind first. However, for men, there is another small but essential part of the body that plays a crucial role in overall health: the prostate. Though it is often overlooked until problems arise, understanding this gland's function and how changes in it can affect well-being is the first step in protecting long-term health. What is the prostate, and why does it matter? The prostate is a small walnut-sized gland situated just below the bladder and in front of the rectum. Despite its small size, it serves a major function in male reproductive health. This gland produces a fluid that makes up a significant portion of semen, helping to nourish and protect sperm as they travel through the reproductive system. Without the prostate, the survival and mobility of sperm would be severely compromised, making conception difficult. Beyond reproduction, the prostate also plays a role in urinary function, because it surrounds part of the urethral tube that carries urine from the bladder out of the body. Any changes in the size or health of the prostate can have a direct impact on urination. This is why many men with prostate issues, including benign conditions like an enlarged prostate, experience changes in urinary patterns. When the prostate goes wrong, understanding the risks. Under normal conditions, the prostate does its job quietly and without issue. However, as men age, this gland is prone to developing complications. Some of these issues are mild and manageable, while others can be life-threatening. One of the most common non-cancerous conditions affecting the prostate is benign prostatic hyperplasia, or BPH. This occurs when the gland enlarges, pressing against the urethra and making it more difficult for urine to pass through. While BPH is not cancer, it can cause uncomfortable symptoms such as frequent urination, difficulty starting or stopping the urine stream, and a constant feeling of needing to go to the bathroom. Then there is prostatitis, which is an inflammation of the prostate. This can be caused by infections or other underlying conditions and often results in pain, discomfort, and urinary difficulties. While BPH and prostatitis can be bothersome, neither is as dangerous as prostate cancer. Cancer occurs when cells in the prostate begin to mutate and multiply uncontrollably. In its early stages, prostate cancer may not cause any symptoms at all, making it difficult to detect without medical screenings. This is why regular checkups and preventive care are so important. Many men have prostate cancer without realizing it, simply because the disease remains silent for years. The slow versus aggressive forms of prostate cancer. Not all cases of prostate cancer are the same. Some develop very slowly, taking years or even decades before they cause significant health problems. In fact, many men with slow-growing prostate cancer live full lives without ever needing aggressive treatment. However, some forms of prostate cancer behave very differently, growing quickly and spreading to other areas of the body, including the bones, lymph nodes, and other organs. When this happens, treatment becomes far more complicated, and the chances of survival decrease. Because there is no way to predict exactly how a prostate tumor will behave, early detection is critical. Catching cancer in its initial stages makes treatment more effective and significantly improves long-term outcomes. The longer it goes undetected, the more difficult it becomes to manage, which is why ignoring warning signs or failing to get regular screening scan have serious consequences. Recognizing the first signs of trouble. Understanding the prostate is only half the battle. The next step is being aware of how changes in this gland can affect your health. Since the prostate is closely connected to both the reproductive and urinary systems, Many of the first warning signs of prostate issues involve changes in urination, ejaculation, or pelvic comfort. Some men assume that urinary problems or discomfort are just a natural part of aging, but this is a dangerous misconception. While aging can bring about certain changes, persistent symptoms should never be ignored. The sooner a potential issue is addressed, the greater the chances of catching a problem before it becomes serious. Why every man should pay attention. Prostate cancer is one of the most common cancers in men worldwide, yet awareness about it remains surprisingly low. Unlike other cancers that may present more obvious symptoms, prostate cancer can develop quietly, giving men a false sense of security. This is why routine medical checkups are not just a precaution, they are a necessity. Men often avoid discussing prostate health due to embarrassment or discomfort about the exams involved. However, prioritizing health over discomfort can mean the difference between catching cancer early or facing it in an advanced, less treatable stage. No test is as uncomfortable as dealing with a late-stage cancer diagnosis. Understanding how the prostate works and recognizing early warning signs are key to preventing complications. By being proactive about prostate health, men can ensure that they remain in control of their well-being rather than allowing a silent disease to take control of them. Why early detection saves lives. Prostate cancer is one of the most deceptive diseases a man can face because it often develops without making its presence known. Unlike other illnesses that cause immediate discomfort, this condition can grow silently for years, allowing men to believe they are perfectly healthy when, in reality, something dangerous is taking root inside their bodies. By the time symptoms appear, the cancer may have already advanced, making treatment more difficult and less effective. This is why early detection is not just important, but absolutely critical. When prostate cancer is caught in its initial stages, the chances of survival are significantly higher. Modern medical advancements have made it possible to diagnose the disease long before symptoms begin, yet many men avoid screenings due to fear, embarrassment, or the belief that they are unnecessary. This hesitation can have devastating consequences. The reality is that early detection saves lives, offering treatment options that are far less invasive and dramatically improving the likelihood of a full recovery. Doctors rely on two primary methods to detect prostate cancer before it becomes a serious threat. The first is a simple blood test that measures the levels of a protein produced by the prostate. When these levels rise beyond what is considered normal, it can indicate an issue that requires further investigation. The second method involves a physical examination where a doctor assesses the prostate for any irregularities. This test is quick, painless, and could be the key to identifying cancer in its earliest stages. Despite the discomfort some men feel about the process, undergoing these screenings is a small step compared to the potential consequences of an undiagnosed tumor. When prostate cancer is detected early, survival rates skyrocket. In its earliest stages, when the disease is still confined to the prostate, the chances of successful treatment are nearly 100%. At this point, options such as targeted radiation, minimally invasive procedures, and even active monitoring are available, allowing men to continue their lives with little disruption. However, once cancer spreads beyond the prostate, the situation changes drastically. The options become more aggressive, often requiring chemotherapy or extensive surgery, and the chances of survival begin to decline. One of the biggest barriers to early detection is the misconception that if something were wrong, the body would provide clear signals. Many men assume that if they feel fine, there is no need to visit a doctor. This belief is not only incorrect but dangerous. Prostate cancer can remain silent for years, slowly growing until it reaches a point where symptoms become impossible to ignore. By the time a man notices significant changes in his body, the disease may have already progressed to an advanced stage, limiting treatment options and lowering the chances of recovery. Another common reason men avoid screenings is fear. The idea of receiving a cancer diagnosis is overwhelming, leading many to put off routine checkups in the hope that if they do not look for a problem, it will not exist. This mindset can be deadly. Ignoring a potential health issue does not make it disappear. It only allows it to worsen. Facing the possibility of cancer head-on is not an easy decision. but it is one that can mean the difference between early treatment and a life-threatening diagnosis. The stigma surrounding prostate exams also prevents many men from taking action. The idea of undergoing a physical examination makes some uncomfortable, causing them to delay appointments indefinitely. What many fail to realize is that this test takes less than a minute. A few seconds of mild discomfort could be the key to detecting cancer early and preventing unnecessary suffering. There is no logic in avoiding a test that has the potential to save a life. Taking control of health means making informed decisions, not waiting until symptoms force action. Every year, thousands of men lose their lives to prostate cancer simply because they were diagnosed too late. This does not have to be the case. Medical science has provided the tools necessary to detect this disease long before it becomes deadly. The only thing required is the willingness to use them. There is no downside to being proactive. A simple blood test and a brief exam can provide peace of mind and the assurance that everything is functioning as it should. If there is an issue, catching it early can mean the difference between a straightforward treatment and a battle for survival. Choosing to prioritize health over fear is the smartest decision any man can make. Prostate cancer does not have to be a death sentence. Early detection offers a way out, but only for those who take the initiative to seek it. Who is most at risk, and why it matters? Prostate cancer does not affect all men equally. Some have a significantly higher chance of developing the disease due to factors beyond their control, while others unknowingly increase their risk through lifestyle choices. Understanding what makes a person more vulnerable is essential, because when someone is aware of their risk level, they can take proactive steps to protect themselves before the disease has a chance to develop. Age is one of the most significant factors. The older a man gets, the higher the likelihood that cancerous cells will begin to form in the prostate. Once a man reaches the age of 50, his risk increases dramatically, and by 65, the chances of developing prostate cancer become even greater. While younger men can also be diagnosed, particularly those with a strong family history of the disease, most cases occur in those who have entered their later years. This is why routine screenings become more important with age, as they provide an opportunity to catch any abnormalities before they turn into something more serious. Genetics also play a major role. If a man has a close relative, such as a father or brother, who has been diagnosed with prostate cancer, his chances of developing the disease nearly double. This risk increases even further if multiple family members have been affected. Unlike lifestyle factors, genetics cannot be changed, but knowing that there is a higher risk allows for earlier screenings and closer monitoring, which can make all the difference in detecting the disease at a stage when it is still highly treatable. Ethnicity is another factor that influences prostate cancer risk. Studies have shown that men of African descent are significantly more likely to develop aggressive forms of the disease compared to men of other racial backgrounds. The reasons for this disparity are still being studied, but the data is clear. Not only do these men have a higher chance of developing prostate cancer, but they are also more likely to be diagnosed at an advanced stage. This makes early screenings even more critical for those in high-risk groups, as catching the disease early is the best way to ensure effective treatment. While age, genetics, and ethnicity are beyond a person's control, lifestyle choices can also play a role in the development and progression of prostate cancer. A diet high in red meat, processed foods, and unhealthy fats has been linked to an increased risk of cancerous cell growth. On the other hand, diets rich in fruits, vegetables, whole grains, and lean proteins have been shown to help reduce inflammation and support overall prostate health. What a person eats has a direct impact on the body's ability to fight off disease, and making healthier choices can lower the chances of developing not just prostate cancer, but many other serious conditions as well. Physical activity also plays a role in reducing risk. Men who lead sedentary lifestyles and carry excess weight, particularly around the midsection, are more likely to experience hormonal imbalances that can contribute to the development of cancer. Regular exercise helps regulate these hormone levels, improves circulation, and strengthens the immune system, all of which can help keep the prostate functioning properly. Even moderate physical activity, such as walking for 30 minutes a day, can make a noticeable difference. Exposure to certain environmental toxins may also contribute to prostate cancer risk. Men who have worked in industries where they were regularly exposed to harmful chemicals, such as pesticides, heavy metals, or industrial pollutants, may be more likely to develop the disease. While avoiding all potential carcinogens is impossible, minimizing exposure whenever possible and undergoing regular medical checkups can help reduce the likelihood of long-term health consequences. Understanding who is most at risk for prostate cancer is not meant to cause fear, but rather to encourage awareness. When a man knows that he has an elevated chance of developing the disease, he can take steps to monitor his health more closely and make choices that may help lower his risk. Ignoring these risk factors does not make them disappear, but taking action can mean the difference between early detection and a diagnosis that comes too late. For those who fall into high-risk categories, waiting for symptoms to appear is not an option. By the time obvious signs develop, the disease may already be in an advanced stage. Being proactive, scheduling regular screenings, and making healthy lifestyle choices are some of the most powerful tools available to protect against prostate cancer. No one can predict the future, but taking these steps ensures that if something does go wrong, it is caught early enough to be treated effectively. The power to take control of health is in each person's hands. The question is whether they will use it. Taking control of your health before it's too late. Prostate cancer is a silent threat that too many men overlook until it is too late. It develops slowly, often without clear warning signs, making early detection the single most important factor in survival. Every year, thousands of lives could be saved if more men took proactive steps to monitor their health, understand their risk factors, and recognize the importance of routine screenings. Ignoring the possibility of prostate cancer does not make it go away. The belief that feeling fine means everything is fine is one of the most dangerous assumptions a man can make. This disease does not always announce itself with obvious symptoms, which is why waiting until something feels wrong can have devastating consequences. By the time noticeable changes appear, the cancer may have already progressed to an advanced stage, limiting treatment options and lowering the chances of recovery.